We're joined this evening by Dr. William Olorunto, University of Toledo Medical Center. Thank you very much for your time.
Thank you.
You specialize in trauma. We often think about trauma as things like car wrecks coming into the ER here, but there is a new type of trauma that you're seeing more prevalent these days. Tell me a little bit about that.
So we're seeing, we see a lot of falls, especially in the elderly people. And what we've noticed with the Northern Ohio trauma registry is that about 45% of the trauma in Northern Ohio in 2008 were falls. And people, when people think about falls, they think it's something very minimal, very benign. But a lot of elderly people, when they fall, they can sustain major injuries to the head, to the hip. And we're talking about injury that could potentially be lethal. So what we would like to do eventually is look at the distribution of those falls. If it's people 60, 65, where they're falling from standing, from the stairs, we could provide some education in the community that can be more like a preventive lectures or preventive measures to sort of have older people not fall as often, because 45% is extremely high.
And I guess, is that number rising, the number of falls that you're seeing year in and year out?
We don't have the data for 2009 because they still have to look at everything retrospectively. All we've looked at so far is 2008. And when we compare Northern Ohio to most of the trauma centers in the country, most places the falls are usually about 30-35%, usually about 30%.
So we're almost 10 to 15% higher than normal. So do you feel like that if there are people at home that are watching that maybe have an elderly parent or an elderly grandparent that they have access to, that maybe they should take some steps to maybe shovel a little more snow, move a little more ice, or check to make sure there aren't things that they could potentially fall over?
Absolutely. I think that's exactly where we're going with this. What we feel is this. Look at the preliminary numbers. It looks like around age 60, there's a big inflection point where that's where most of the falls are occurring.
Okay.
So if that's the case, number one, elderly people probably want to be in a house that doesn't have stairs. Very important. And we used to think that was nothing, but it's very important because not having stairs will prevent you from falling from stairs.
Sure, I mean that's just it's common sense. But that's difficult to do if you're in a house and you don't have the situation where you can move. That's what you have.
So if you do have stairs, then they should have rails on both sides.
Okay.
That way, it doesn't matter which way you're coming, you can at least have something to hold on to. That's one. Now, people falling from standing is usually bad illumination in the house. They get up in the middle of the night and there's no light and they stumble on something and they fall, and they can hit their head against something fairly hard and sustain
anything. Yeah, if they lose their balance.
So we just have we see a lot of areas in the elderly people, especially, that we think we can really make a big difference.
Okay, good. I mean, I think they're very practical pieces of information that people can take home.
Very, very practical.
Well, we thank you very much for your time, Dr. William Olorunto, University of Toledo Medical Center, and that is your evening's Talk Back.